Hello everyone. Then palpate the scalp for any swelling and see if swelling is present. Is it the caput succedaneum or cephalohematoma or subgaleal hemorrhage, or sometime in the forceps delivery baby will have the some injury marks. By this image you can understand the scalp swelling. These are the layer of scalp. First is the skin layer. Below the skin, this is the subcutaneous space. Below this it is epicranial aponeurosis, and this is periosteum dotted line. This is the skull bone, and this is the periosteum, and this is dura, and this is the brain tissue. Whenever at the time of birth, because of the pressure on the fetal head during the delivery process, serosanguinous fluid is collected in the subcutaneous space. It will lead to the swelling, and it is known as caput succedaneum. It is crossing the midline, present at the time of birth, generally resolved by 72 hours of life. No complication occur because of caput succedaneum. Now, because of the trauma at the time of delivery, bleeding can occur in the subperiosteal space between the skull bone and periosteum, and this swelling resolve by few weeks to few months after birth. It generally take the 1 to 2 months, and this swelling is not crossing the midline. And we have to counsel the parents also, because this swelling takes the few weeks to few months after birth to be resolved, and this can lead to the exaggerated jaundice, and also sometimes anemia can occur because of cephalohematoma. Sometimes because of the trauma at the time of birth, emissary veins are ruptured in the subgaleal space. It leads to the subgaleal hemorrhage. This swelling present between epicranial aponeurosis and periosteum. This is huge swelling compared to the caput and cephalohematoma. And this swelling can lead to the life-threatening complications also. Example, patient can develop the hypovolemic shock or sometimes severe anemia. So close monitoring is required. This is suggesting epidural hematoma. It is a rare in neonate, except whenever there is a neonatal head injury occur, which is very rare, and this is between the outer layer of dura and skull bone. So you have to remember all the scalp swelling, and you have to examine the newborn to see any scalp swelling is present or not. Here in this image you can see this is the bogey swelling crossing the midline present at the time of birth. It is caput succedaneum. This swelling is also similar caput succedaneum. Here in this image you can see the swelling which is not crossing the midline form. It is cephalohematoma. So the basic difference between these three swelling: caput present at the time of birth, it is subcutaneous swelling. It is because of increased intrauterine pressure on the head during the labor time. This swelling is soft, boggy and fluctuant and pitting edema, and it also crosses the midline as it is present above the cranial suture line superior to the periosteum, so it crosses the midline suture line. It typically resolves spontaneously within 72 hours of birth. Here you can see this is caput succedaneum. While the cephalohematoma, it is subperiosteal bleeding due to injury of blood vessels, and it is firm and fluctuant swelling. It is not crossing the midline as it is present inferior to the periosteum, and it is resolved between 2 weeks to 6 months of life. Generally, it takes 1 month to be resolved, and there is an increased risk of anemia, jaundice, and sepsis, and commonly seen with the forceps and vacuum extraction. Subgaleal hemorrhage, in which blood is collected between epicranial aponeurosis and periosteum. It also crosses the suture line, but this swelling is more diffuse, and it can even enlarge further and may shift with the movements. And serial monitoring is required And hematocrit should be measured serially because it can lead to the hemorrhagic shock also. It is generally seen in vacuum extraction. Thank you so much.